Hi, my name is Yekta and I'm 16 years old. Today I'm talking to Professor Sharon Goldfeld about why it's important for every child to have the opportunity to live a healthy and fulfilled life. How is the work you're doing at Murdoch Children's Research Institute transforming child's health?
Well, here at the Murdoch Children's Research Institute, we're always trying to transform children's health, and we do it in different ways. So the way that I do it, together with my team and all the research groups I work with, is we're trying to create better systems and services and policies for children. We're doing research that helps services work out how they can be better, how they can make sure they're really delivering the very best to those children who most need it, or that they're reaching the children that most need it. And they're starting to work together, health, education, social care, and we're using digital technologies for trying to work out how to connect with families. So what we're trying to do is, rather than saying, hey, just this service can you do well, we're trying to stack all those services together. So antenatal care, early childhood education and care, healthcare, all working together. So by the time that kid starts school, doing great pathway, great life.
What is the equity gap and how do we close it?
Well, let me give you an example of the equity gap. That's probably the best thing. So what I can tell you is, by the time children start school, there are 3 times the difference in their level of what we call developmental vulnerability. In other words, they're not kicking goals by the time they start school. And those 3 times the difference is between kids who live in the poorest areas of Australia compared to the wealthiest areas of Australia. So that tells us, hey, there's a lot of stuff we could be doing here to close that equity gap.
Have you always wanted to work with children?
I really have always wanted to work with children. So I started off when I was younger, working with children as a youth group leader, and then I became a doctor that only wanted to work with children. But I kind of realised that no matter how much I worked with each individual child, which was fantastic, I really wanted to make a difference to lots of children. And the only way to do that was research, and the only type of research is public health research. And the only place to do that is Murdoch Children's Research Institute, and really trying to work out how do we make a difference to children's lives here in Australia and internationally, and particularly around children's development.
That's amazing. Thank you so much.
You just want to die when you see your head that big on a screen, don't you? Really? And I thought, if I wear the same outfit, they think I just did it back there and walked in. But I couldn't resist the pants, so I went with a different outfit. So good morning, everybody. It's just an extraordinary honour to be here on the stage talking about issues that we all feel passionate about, and in particular about these biggest child and adolescent issues and public health issues facing us. So we've already had an amazing welcome to country and acknowledgement for country, so I wanted to do something a little bit different. I wanted to talk to you about William Cooper. This is a statue of William Cooper, who's a Yorta Yorta man. He's an Aboriginal man, and he started the Australian Aboriginal League back in the 1930s, actually. So he was looking to give a voice to Aboriginal people. And he's an extraordinary man for a number of reasons, but I put his statue up there because in 1938, after Kristallnacht, which was the beginning of the Nazi regime, they went in and destroyed a lot of Jewish shops, so there was a lot of looting and a lot of violence. They decided, and under his sort of leadership, to march to the German consulate to say something about what was happening under the cruelty of the Nazi regime to the Jewish people. So I thought this was really appropriate because of 2 things. First of all, it shows what happens when you give a voice to people who don't have a voice, is that they give a voice to others. And I guess the second is, from my people to the Aboriginal people, thank you. So it's a good segue, I think, to thinking about population health and the context of the lives that we all are trying to make a difference to. And so I'm asking you to hold a couple of concepts in your mind when you're thinking about population health. One is the N of 1. So we still care about individual children, and in fact in population health and the public health work that we do things that make a difference to individual children. That might be about curing diseases or preventing diseases that affect individual children. So we're holding the N of 1, but we're also holding the N of many. How do we keep populations of children and adolescents healthy and developing well? And we continue to hold those 2 things And we work across the whole spectrum of those two things. And these are the sort of common conditions, and we're trying to sort of prevent some of these common conditions. These are from the Australian Institute of Health and Welfare, this very gorgeous report on Australia's children. And if I just go through these, you can see all of the things we focus on in population health, so mental health, allergy, children with developmental problems. This is what they're sort of reporting on in the Australian Institute of Health and Welfare. And in fact, these are the common conditions we're trying to make a difference to prevent, to intervene early, and in some cases, cure, because these are the conditions that are going to impact the future lives of our generation. I really like these slides because it talks about what's happening over time. So we've got these high prevalence conditions that we're trying to make a difference to, and over time, these conditions are sort of getting worse. This is a neat slide because it also reminds us that we're spending more per capita on children. This is in particular in education, but actually all the outcomes we care about over time are going south. And of course, the other trend I want to share with you is the trends in inequity. So the graph on the right is the children starting school. This is the Australian Early Development Census between the lowest and highest income area. And you can see they're kind of tram tracky. They kind of just, we haven't changed much in inequities in over a decade. And the other is the completion rates of year 12, and looking particularly at Australia versus rural and regional areas. And similarly, you've got these differences between the metropolitan areas of Australia and the rural and regional remote areas. And again, not much has changed. And this is a wake-up call to us, right? This is a wake-up call to all of us to say, what are we going to be doing that's going to make a difference for children and young people into the future? And these are the sorts of concepts that we think about in public health and population health. And why? Why do we even care about this? Because it turns out if you can't get children kind of kicking goals over that children as they age, as children and into adolescence, what we see is a difference in mortality. So it's not just about, hey, we want to make better lives for children and young people, but it is about trying to prevent mortality in this country. And this, what we're looking at, what we're looking at down here, it doesn't have a little thingamajigger. What we're looking at in the yellow square there is the differences of 9 years between those who haven't finished high school. So everything we're doing about making sure that children are doing well at school and are healthy makes a difference to how young they die. Now, the other part of the whole population health story is this idea of social determinants, which is really about understanding where children and their families live, work and play. And the reason the social determinants are so important, this is some work that was done in Europe looking at the contribution of a whole range of factors to inequities in health outcomes. And what you can see is health services themselves only contribute 10%, so still very important. But look at all the other things that contribute to the lives of people. And so it means that when we're thinking about the lives of children, we need to think about the lives of the context of their environments. And you can see all the other things there about employment, etc. So I want to drill down a little bit into that idea of social determinants. We throw it around a lot, actually, in public health, but we realise that maybe not everyone kind of fully understands what that means and why it's important for us. But actually, I can't do it as well, and I'm going to read this out because it's the only way I can do it properly. This is artwork by Emma Nanenja Stubbs. She's a researcher that we've been working with in Congress in Alice Springs, and it represents a study we've been doing with her, which is in English, Healthy Journey for Kids, but I'm going to read it out in Aranda, and I apologise to anyone who speaks in Aranda. It's Achepa, Iwara, Ampaka. So Healthy Journey for Children. This is Emma's words, which I'm reading out to you about this, and I can't talk about the context of people's lives any better than Emma has. This painting tells the story about growing up strong and healthy in Mbantwe, including the importance of secure attachment with caregivers, access to education, access to shelter, feeling safe to be able to grow your family through community support and connection. There are elements of Mbantwe that I've included to demonstrate the important role that culture and our Dreamtime stories play in shaping our future and identity for our little ones by building strong and resilient families. You will see the Yeparinya, the Nachalika, and the Unut Ungach, I knew that one would get me, who are beings of great significance for the Aranda people. Also, there are the paw prints of the wild dog that protected the entrance into the Mbantwe. Another important element to this painting shows the many riverbeds that connect Mbantwe to this land. Mbantwe is the traditional name for the township area, which means watering place, and it references a waterhole in the Todd River at the old telegraph station. And you can see, I don't think I could really have said this any better than Emma has, and in this magnificent painting, which we have permission to show today. So I might get my population health colleagues to come up here. This is our slightly less artistic version of exactly that, talking about the socio-ecological model of health, really, understanding children live in families, families live in communities, communities need services, and services need policies. And so what we're going to do with you this morning, I took really serious the challenge of how we might make this interesting and entertaining. And there are various views on how people feel about green t-shirts right now. But I couldn't possibly talk to you about what was happening in population health without really showing you the extraordinary breadth of what we do and the extraordinary science, but more importantly, the extraordinary people who make up the researchers in this organisation. So they're going to share you, this is like a degustation of population health. Like all degustations, take as many photos as you like. However, don't clap till the end, because this is a highly timed exercise. And the other is, you'll see the stream through this is mental health, because as you all know, this is a major issue. And then following that, this is the last slide that I have. This is from the James Webb Telescope. And it's really the idea of how do we build the data infrastructure that's going to provide data for all of you and for researchers around the world into the future, so that, as you can see, a world that centres on prevention, early intervention and equitable care for children, in fact, where children thrive. And we're going to be talking about Gen V and Life Course as the epicentre of that. But now I'm going to hand over to the extraordinary population health.